Rapid advances in technology allow us to explore the human body with technology which just a few decades ago didn't exist. Today, MRI scanners, CAT scanners, 4D high-resolution ultrasound, among other radiographic techniques, are used every day in hospitals across the world to image our bodies in such incredible anatomical detail, the use of cadavers may soon no longer be necessary to teach anatomy with. We're proud to introduce the Virtual Anatomy Laboratory at ATSU as among one of the very first technological innovations to teach you an entirely new method of learning anatomy in preparation for an amazing career in medicine. Welcome to this presentation on cross-sectional anatomy. In this presentation, we're going to introduce you, the first-year medical student, to rapid and innovative technologies used to teach anatomy by introducing you to cross-sections of the human body in high resolution that'll make your television showing 1080p or even 4K ultra high D technology look like you've been using Crayola crayons in the past. I hope you enjoy the presentation. Most of the references used in this presentation and some of the images and much of the technology revolve around data collected from the Visible Human Project. We'll talk about the Visible Human Project in a bit, but first, you must learn to use the program VH Dissector Pro. And you'll need to read your workbook, Sectional Anatomy for Imaging Professionals 3rd edition by Kelly and Peterson, in order to complete your understanding of the anatomy we're about to talk about. A purchase of VH Dissector Pro, even though it's available to you on the anatomy computers in the virtual lab, will prove useful to your anatomical and radiological education, especially in your clinical years, as you learn to read CAT scans and correlate those scans with the actual human anatomy of your patients. Their lives will depend on it. The injection of cross-sectional anatomy into the teaching of human gross anatomy is becoming more common in anatomy curricula in medical schools across the United States and the world. As you become a physician, you'll learn that most of the images you actually use in your career will be cross-sections. Because of this, the learning objectives are quite broad. In brief, here's what's important. You'll need to be able, at the conclusion of your first year of medical school, that's a year away, to relate cross-sectional human anatomy images to the corresponding radiographic, CT scan, MRI, ultrasound, and mammographic images which you'll encounter. You'll need to discuss the importance of using cross-sectional anatomy to the clinical practice of medicine and give examples of imaging techniques that use and rely on cross-sectional anatomy. You'll also need to review the anatomical positions used in viewing cross-sectional images and how to use that anatomical positioning to help you read and interpret cross-sectional images. You'll also need to correlate the anatomy that you see on a cross-sectional image to the open anatomy that you'll see in the human body and in the cadavers upstairs. Also, you'll need to describe how cross-sectional anatomy can help you understand embryology and gross anatomy a little better. And perhaps most importantly for this presentation, you'll need to recognize just the simple, normal anatomy of the human on a cross-sectional image like the examples that we're going to show you. So why teach cross-sectional anatomy? Because for the rest of your career, this is how you're going to see anatomy. You'll see anatomy and pathology in CT scans, MRIs, mammograms, ultrasounds, and a host of other imaging technology using cross-sections. You'll see it through transverse, coronal, sagittal, and maybe even oblique sections. And there's lots of examples given in this presentation. Holographic imaging is already on the horizon. You're at a great time to be experiencing the growth in technology in medicine. This is a screenshot from VH Dissector Pro, the premier teaching aid in learning cross-sectional anatomy. You can order your own copy if you'd like, but this program is already available to you in the Virtual Anatomy Lab. Cross-sectional images are commonplace now in the national medical boards. Images of cadaveric images are not. By the end of this presentation, you'll understand why cross-sectional anatomy, combined with other methods such as cadaver dissection, autopsies, surface anatomy, physical examination skills, and anesthesia, which allows us to see anatomy in its normal and sometimes abnormal physiological states, is arguably one of the most important anatomical tools in your armamentarium to take care of your patients. For example, cross-sectional anatomy, not just radiological imagery, has been used now for hundreds of years via microscopy. Microscopy, histological images will appear on your board exams. While you and I don't normally think of cross-sectional anatomy as applying to the microscope, in reality it's the same. Here I've taken a large tissue specimen, cut in incredibly thin slices with a microtome, stained it, and you can get a diagnosis from it by looking at it under a microscope. We don't need to look at the entire tumor. We look at a cross-section of the tumor. From this cross-section, we can look at the structure of the cells and determine whether it's cancerous, whether it's potentially malignant. Cross-sectional histology and microscopy has been used now for hundreds of years, but now cross-sectional imagery will define your career. Clinically, it wasn't until the advent of the CT scanner or the MRI scanner that cross-sectional anatomy literally overtook hospitals. We'll take a look at some examples in this presentation. So who is cross-sectional anatomy used for? And why should you learn it now? You're just a first-year medical student. Because there is no better time. In fact, the author of a textbook about cross-sectional anatomy says the following: the practice of medicine has come to depend more and more on the examination of internal organs by imaging methods. If one takes a cynical or a candid perspective, it almost seems naive for a physician to do palpation of the body in an attempt to define maladies of internal organs. Recently, I visited the Mayo Clinic as a patient. I had a chest x-ray performed before a doctor even touched me or listened to my lungs or took a medical history or performed a physical exam. The truth is, it's not cynical. It is a candid perspective. Today, you will likely obtain some sort of image on your patients before you talk to them or examine them, especially patients presenting to the emergency room. Sad? Maybe, but it's reality. So let's face it, if they had CAT scanners in the 1700s, medicine today would be a lot different. As I alluded to in the previous slide, there are some physicians that argue the demise of the physical exam has occurred because of our quickness to reach for a radiological image. This quotation, also from the author of that same textbook, says the following: the relevance is readily apparent to learn cross-sectional anatomy if one recognizes how frequently patients in a hospital have an imaging study before they even have a physical exam, just like what happened to me at the Mayo Clinic. The reality is cross-sectional imagery is so valuable and provides so much information, in many cases multitudes of information, than you can simply glean from the physical exam. While many of your professors may not want to admit this, it's true and they know it's true. Yes, you should talk to your patient. Yes, you should examine your patient. But there will undoubtedly come a time when you'll need to look inside them too. We have the technology. When Dr. William Osler, a famous physician from Johns Hopkins University, taught his medical students about pectoriloquy or agophony, two special methods about listening to lung sounds, he didn't have our technology. But you can still use his physical examination techniques to hone the information you'll glean from imaging studies. They're all tools. They're all just tools. Physical examination, taking a medical history, and looking at your radiographs are all tools. In fact, one of the most important lessons I can teach you is this: I must insist that for the rest of your careers, you must always look at every single radiograph which you request. even if it's a simple chest x-ray or a fracture of a broken bone, down to a complicated image of the biliary duct system. You have to look at every image. You'll learn anatomy better, and you'll be able to treat and teach your patients more competently, and they'll appreciate it. You may ask, Dr. Crutchfield, when am I going to have time to learn all of this? You're expecting me to learn anatomy, embryology, physiology, biochemistry, pharmacology, and hematology? When is there time? Are you nuts? The truth is, you need to learn cross-sectional anatomy now. In fact, the author of the textbook and I both agree. He says, immediately, after having learned the terminology and perused stereotypical illustrations in the anatomy text, is the time to begin studying cross-sectional anatomy. You might want to look up the word perused. Most people think it means to glance at or just to look at briefly. It doesn't. Peruse means to look at something carefully in detail. So once you learn the anatomic terminology, you'll go on to learn cross-sectional anatomy. It'll make you a better doctor, and now is the time to do it. Go ahead and take a second and click on this link. Dr. Olson, one of your anatomy professors, explains body viz and VH dissector. Click here and listen to him. It's incredible the technology that we're going to use in the virtual anatomy lab to teach you cross-sectional images. Again, there's support from doctors, anatomists, and radiologists on when and who should be learning cross-sectional anatomy. The preface of this book again says it very succinctly. Primarily, this book was written for first-year medical students. So in case you've forgotten, that means you. That means the time to learn cross-sectional anatomy is now. In retrospect, the student realizes the best time to have learned to identify anatomical structure in tomographic images was during gross anatomy. Guess what? That's now, and that's what we're going to do. We're going to learn gross anatomy, open body anatomy, and cross-sectional anatomy. And yes, we're going to expect you to become familiar with it, all by the end of your first year. We've got to talk about the word tomogram. We'll get to that in just a second. So where does all this information come from that's used to teach cross-sectional anatomy? It originally came from the Visible Human Project around 1991 at the University of Colorado Health Sciences Center by Dr. Vic Spitzer. There, a convicted murderer who after being executed was placed in epoxy after being embalmed was sawed into 1 millimeter increments. Those are the images you'll see on the computer program VH Dissector Pro, which we have available to you in the virtual anatomy lab. Later, a 39-year-old female was also sectioned in the same manner, but into even smaller sections, 0.33 millimeters. And before they did that, they performed a CT scan on her. A CAT scan was not performed on the convicted male murderer first, however. If you put your presentation on pause and read this cover page from the website of the National Library of Medicine, you'll learn that the Visible Human Project has been used by many commercial sources, taking the data gleaned from sectioning those cadavers, and has now been used by multiple sources to teach medical students, radiology residents, anatomists, surgeons, and radiologists cross-sectional anatomy. The link at the bottom of the page to the Visible Human Project will take you to a YouTube video. For those proponents of cadaver dissection and cadaver dissection only as the way to learn your anatomy, I offer the following comparisons. On the right, we see one of our cadavers. It's embalmed, been dissected, and sadly is fairly shredded. On the left is an actual image taken from a laparoscope at the time of an operation. I've labeled some structures to show you the similarities, or better yet, the dissimilarities. You can see the liver on the left and then the liver in the cadaver. The blue arrow points to the gallbladder in a normal adult specimen. On the right, The shrunken, shriveled gallbladder can be seen in the cadaver image. You can see the small intestines in the cadaver and the colon on the left. In a living person, the truth is, except for morphological similarities, i.e. the structural similarities, there are no similarities. For those who argue the way to teach anatomy is through cadaver dissection, I would argue, for the rest of your careers, you will never see anything that looks like the specimen on the right. In the operating room, live tissues do not look, feel, or smell, the smell of formaldehyde, move, or have any resemblance to cadaver dissection. The texture is different, and even more so in the operating room, your specimen will bleed. Now, I know many of you don't want to be surgeons, but the tool we all have in common to see anatomy and learn anatomy on the living, breathing human patient is cross-sectional anatomy. When you order a CT scan on your patient and you share the results and images with your patient, you're looking at real anatomy. Cross-sectional anatomy is simply another tool in your education. To argue cadaver dissection alone is the end-all of teaching anatomy at the medical school level is being short-sighted. That's similar to learning how to drive, take apart, and never upgrading a Ford Model T, while never learning how to put it back together again. Medical education must advance with technology, and that's what cross-sectional anatomy does. That's how we're going to use it in your medical school career. Just wait until we demonstrate some of the programs in the virtual anatomy lab. An example is a program called BodyViz, which converts cross-sectional anatomy back into 3D structures. Still unconvinced? Here are two more images. We see an embalmed cadaver showing the ascending colon, and another image taken from an actual operative photograph showing what the ascending colon and a redundant transverse colon actually look like. There are very few similarities except for morphology. They feel different in the operating room, they look different, and one of them will actually bleed, but that's not the point. The point is they're all tools to learn anatomy, and some tools are better than others. They're all tools: cadaver dissection, cadaveric videos, operative experience, and cross-sectional anatomy. One of the best tools available that our school makes available to you are the Ackland Anatomy videos, available at acklandanatomy.com or through the LRC for free. You need to check it out. Today, the technology allows us to correlate cross-sectional anatomy with radiographs. Not only will you learn anatomy, but you'll also learn some basic radiology. But if you want, go ahead and hop in your Model T, maybe even your Model A. While you're doing that, I'm going to hitch a ride on the next shuttle. You're halfway finished with this presentation. In Part B, we'll continue to discuss the importance of cross-sectional anatomy. And at the end of Part B, there's a small quiz to reinforce those salient features and topics which we want to reinforce.